introduce, before I introduce our guests, kindly indicate in the chat room where you're logging from so we can acknowledge you. Let's do that quickly, and thank you very much for joining in. Please indicate in the chat room where you're logging from. Sudan, thank you very much. Zambia, thank you. Welcome. Syria, Kenya, thank you very much. Tunisia, Germany, thank you very much. Ghana, Netherlands, Beirut, Nepal, thank you. Nigeria, Hungary, thank you. Iraq, welcome on board. Germany again, thank you very much. Pakistan, Netherlands, Uganda, thank you very much. Sierra Leone, wow, the whole world is here. Jordan, Lesotho, thank you very much. Zambia, Egypt, Indonesia, welcome, thank you very much. Very encouraging. Togo, Nepal, South Africa, Namibia, welcome. Thank you very much. United Kingdom, Benin, Philippines. Wow, amazing, amazing. Thank you very much. Nepal, Rwanda, Russia, Liberia, Afghanistan, South Africa. Thank you, everyone. Thank you, everyone. Thank you very much. Yemen, Bangladesh. This is encouraging. Thank you. Thank you very much. Well, let me take this opportunity to introduce our guests, and our guests today are Faye Candelieri. She's the marketing director at Info. Activity Info is our partner. We also have Mercy Uwor. Mercy is an M&E consultant with CIHA Network from Kenya. And of course, Ziroj Abasi, also working with Activity Info. This webinar is brought to you by Strategia Netherlands, CIHA Network, and Activity Info. So without further ado, I would like to invite Faye to introduce herself and Mercy, and also then guide us on the way forward. Basically, you know, as we've always done in the past, we have introductions, then we'll have the presentations, and then we'll have question and answer and closing remarks. This should take us about 1 hour. So thank you very much. And Faye, please take over and guide us in the next step. Thank you.
Thank you so much, John, for hosting us here today. And thank you everyone for joining from all over the world. We are so excited to see you here. I'm Faye Candelieri. I'm from the Activity Info team. I'm the marketing director there. And together with my colleague Uruj, we are producing content related to M&E, and we're trying to make sure that you can get access to this. And Activity Info is an information management software for data collection and analysis that is used for monitoring and evaluation, information management, case management, and more. So without further ado, I would like also to welcome Mercy Uwor. Mercy, would you like to introduce yourself?
Yeah, absolutely. Thank you so much, Faith and John. And thank you everyone for joining. I am thrilled and excited to be here. And thank you so much for inviting me to this webinar. So I am Mercy Uwor. I work with CIHA Network as the M&E consultant. Currently, I'm based in Uganda. We work in the Horn of Africa with Uganda as the regional office. And I have a public health background with a passion and interest in monitoring and evaluation. So thank you so much for joining.
All right, great. So let's move on with our questions, because we have a lot of things to discuss about this very interesting topic on participatory monitoring and evaluation. And let's get started. So my first question to you, Mercy, is what is participatory monitoring and evaluation, and why should we care about it?
Yeah, thank you so much, Faye, for that question. I know this is something that many have been asking. It's getting a lot of momentum and interest. Yeah, so for me, it's I would say it's a philosophy, or rather a way of thinking that kind of puts emphasis on shifting the role of M&D, or the power relations, from the external consultants to the people who are affected by the issues we are trying to address using different innovations. Yeah, so putting them at the driving seat so that they are the ones leading the process, guiding decisions, coming up with solutions about the challenges they experience and the solutions they see, and also being part of evaluating the whole process. If it was an intervention, then what does that change looks to them, instead of coming from an external point of view, but rather working with the people who are affected by the change. That's number one. And then number two, it's more, it goes beyond the accountability tool that it's been known to be about, to rather a more diverse, inclusive process, so that it's not just go in there, get in there, get the information and get out, but a process that's done together with the people we're working with or the beneficiaries from the beginning to the end. So that's how I would look at it, rather than the seasoned M&E where there are intervals. We say, oh, we will do a baseline and then we come in and do end line, but not necessarily involving the participants or the beneficiaries from the beginning. So having them throughout the whole continuum of intervention or implementation process. Yeah. So that's how I would say.
Thank you, Mercy. And why should we care? Like, why is it important? Why this topic is becoming more and more important in our everyday work?
On faith, yeah. So M&D for me, it's, as I said, it's a way of thinking. It's a philosophy that we need to shift, emphasizes on the need to shift the power relations between communities and the donors and the program managers and other stakeholders. So for me, it's very, very important to have the people who are affected by the change that we want to address to be part of that process, rather than us coming from outside and defining for them what change needs to look like, or defining for them how we want to see it done, and the challenges they experience, the solutions. We come in with already defined solutions rather than the other way around. So having them be at the driver's seat, I think is so important, so that when they're able to speak into the process, then definitely that's, for me, is the way we are going to see the change that we want to see. And then also the differences and the diversity in our cultures, our way of life. Yeah, so what worked in a different context might not necessarily work in this other context. So coming in a participatory way to engage the communities, to learn more about their experiences, their lived realities, and using that to craft the interventions and the kind of change we want to support. Yeah, so it is very important to have their voices involved, be part of that process, elevating their voices rather than coming in with defined solutions and defined ideas on how we want to see it. Yeah, so yeah, it's important to work with the communities, with them and alongside them, rather than working for them. So coming in with solutions that we think would work for them, but rather working alongside them to develop those ideas and solutions that we would want to see. Because that way, then the change is long lasting, it's durable, and the ownership is there, the sustainability aspect, when they are part of the process. And this is usually not the case, because in most cases we see us coming with interventions that are not culturally appropriate, they are not sound, they're not technologically sound, and then they end up not working, and then we don't understand why it didn't work here and it worked in the other place. And I think for most of it, it's because of the lacking in participatory, engaging the communities in the process. Yeah, so that's why I think it's very crucial and important to use this methodology in our processes, so that we are able to build long-lasting solutions, sustainability, and ownership. Yeah.
Yeah. Thank you very much, Mercy. This is very important to understand. And I keep as a keyword the word ownership. I think, yeah, that's if we start from there and like keeping our ears open and our understanding, we can help the communities. I would like to ask my second question now, which will help us understand better how participatory monitoring and evaluation looks in practice. So maybe you could talk to us about methodologies or tools, or give some examples of how this actually takes place.
Yeah, thank you so much, Faye, for that question. I think it's also critical that as much as we talk about it, then how do we actually do it, or how do we engage with it? Yeah, so participatory methodologies, I know they've been there from as early as the 60s. Yeah, and probably we have used different terms towards it, not necessarily, the participatory M&E, but we've used different terms. For example, in the early 60s, early 70s, we had the participatory rural appraisal or rural learning methodologies that were used to engage communities, rural communities in, for example, agricultural projects or projects on livelihoods and stuff. Yeah, so it sprang from that period when there was a lot of engagements around, engaging rural communities to in terms of livelihoods projects and agricultural projects and stuff. Yeah, so there are different methodologies. There are some that are new that have come in place, and there's so many of them. Some of them are things we do unconsciously, knowing that this is part of the process. Yeah, so giving examples to that, I would talk about, for example, the storytelling aspect, where you engage communities through focus group discussions, you do key informants interviews with people just to get their stories and their perspectives around the issues we are trying to look at. So that's participatory. There's also the new ones that have come in place, photo voice, these journals, having beneficiaries document their stories using journals, and then looking into that and analyzing that information that they document as they go on their daily lives and stuff like that. Photo voice, for example, in regions where people are not able to write, but just capturing stories as they go about their daily lives. And some of them is done through paintings, through pictures, to depict their lives or what's happening in their lives. And we've seen a lot of this in revolutions, for example, the Sudan revolution and other revolutions, where you see murals on the wall. Yeah, even in Kenya, when you go to Kibera slums, you'd see a lot of pictures depicting post-election violence, that just done in picture form or in photos or art or graffiti or something. So that's also old, and people have been using those ones. And also activity logs, like recent ones, where you work with the group of activists, just to keep track of what their activism activities, because advocacy, for example, is a long-term process. You don't do something today and you achieve tomorrow, but it takes a process. So documenting those processes that would get you there, and then coming together to evaluate the process and see where did we miss it, or where are we likely to succeed, what do we need to adjust. Yeah, looking at those logs and being able to analyze and speak into it to guide the process or how it needs to move forward. So those are also tools that have been used. The other ones would, for example, I know some of you have used, for example, transect walks that were done for, we call them open defecation for water sanitation and hygiene projects, where you're trying to engage the community to control or reduce open defecation. So working jointly with the community in that process. So engaging the community throughout the process, and the community themselves holding each other accountable, because we need the entire community, because one family, if it is not doing the right thing, then we are likely to get cholera if something happens. So, and making sure the whole community is part of the process. So those have been done, and those are some of the participatory methods that have been used. There's also change diagramming, working with communities to document seasons and change that happens, so that you're able to identify trends along the way. So during these periods, this happens. Community mapping exercises that have been done to map out services and hotspots, for example, for maybe let's talk about SGBV, sexual and reproductive health. So using like a community mapping exercise together with the communities, just to map out the areas that they see are kind of hotspots, and then speaking into that and focusing your interventions around what they provide. And a lot more like outcome harvesting and outcome mapping processes. There's also most significant change, the new ones that have come. Yeah, so I know there's a lot more to this. And yeah, those are some of the practical examples that I would give. Yeah, thank you.
Thank you, Mercy. Yeah, this is so interesting. And you really painted a picture of all the options that are out there through history. And like from what I understand, what it's important is to be able to find tools and methodologies that match, that are adjusted to the actual community, and not just go with the tool we believe that will work, and essentially give a way of expression and communication, the correct way for the community to express themselves and participate in the process. I'm gonna continue with a different question. So could you tell us what are the biggest challenges you have faced when trying to adopt a participatory approach to monitoring and evaluation? Maybe some examples, or how did that work?
Yeah, thank you so much, Faye. Yeah, before I speak into that, I saw a few comments on the chat. Yeah, someone mentioned about ranking, scoring. Yeah, those are definitely some of the methods. And some of it requires a guided process. Otherwise, yeah, we've used like scoring and ranking processes to be able just to narrow down priorities or issues in terms of challenges. Yeah, they help to narrow down priorities or issues. So those are definitely some of the methods. And going to your question, Faye, about challenges that I have experienced in doing some of these. Yeah, there's a lot of challenges that I have experienced while implementing this or being part of this process. And as I said earlier, it's a learning process. We learn by doing. We see the mistakes and the challenges we make, and we improve. We try to improve or find better solutions. So to start with, one of the biggest challenges for me is about in most cases that as M&D practitioners or as evaluators, you are sent to go and evaluate a project in a different region or locality that you're not so familiar with, and then just defining the tools, the methodologies outside, and then going in there and thinking they're going to work, and then you go there and you realize, oh, this is so different, from what I thought. So for example, you want to do, let's say you want to do a focus group discussion. Let me pick a very good example of focus group discussion. And then it's about having a discussion with the traditional leaders, religious leaders about, for example, issues around gender or how religion affects or perpetuates gender, issues around gender. And in this group, you have both female and male religious leaders, and you thought maybe it will give you a bigger picture, it will be able to give you diverse opinions and views when you bring all these people together. And then you sit there and you realize, oh, the women, you arrange chairs, you come, you arrange chairs, and then people are sitting, and you realize the women are not interested in taking the chairs. They sit on the floor, and you don't still understand what's going on, and you let them sit. And then the discussion starts, and then it is just the men who are speaking throughout. The women are not saying anything. And you try to probe them, you try to poke them, you try to just to get them participate in the process, but nothing is happening. But then later on you realize this was not culturally appropriate. The methodology I chose was not culturally appropriate. I wish I knew better. I wish I did kind of an exercise to engage them, to see how best we can engage in these conversations. So then you end up with a skewed data where you wanted to understand about gender perspectives, but definitely the women could not speak, not because they didn't want to, but the culture, the practice doesn't allow them to speak in that kind of a setting. So maybe having a separate meeting or a separate conversation separately would have worked better. So that's one. In our choice of methods and tools, we end up choosing tools and methods that don't necessarily work for the communities that we work with, based on their own biases and their own practices that we were not aware as external practitioners. So it's definitely important to have that initial engagement in the initial process, so that as you plan an intervention, how are we going to evaluate this process? Who will we need? What tools will we need? So that is one of the challenges that I've faced, and I know most of us have experienced that. The second one is about, knowing the balance, because I know in most cases we get pushback from donors. They say, we want you to do outcome mapping and outcome harvesting. And that's one of the methodology that we are trying to promote, or feminist M&D, feminist participatory M&D. Yeah, those are cool terms. And sometimes we tend to run towards those because they are cool or they're the in thing, without really understanding the concept. What is this about? How do we do this? Do we have the knowledge to do this? Do we have the expertise to do this? Or we will do it because it's cool, it's the trending thing, and the donor wants it as well. And then we haven't looked at our resources because we don't understand the concept and how resource intensive it is, how skills it requires, technical skills. And then we end up realizing that, oh, this is not possible. We try. And then at the end of the project, we haven't done it perfectly well, or we haven't gotten the right people, or even we don't have the time and the resources to do this. So that's another challenge that I have personally experienced. Whereas looking at it, some of it, a simple reflective meeting or reflection meeting with the beneficiaries would have worked, rather than this intense, resource intense process that we outlined that we are going to do. Yeah, so that is another challenge that I have personally experienced. So the need to figure out how to balance all these and get the necessary information in a participatory way. Yeah, and the last one is about it's about more of as practitioners. Again, it goes back to the tools selection, and also, you end up doing a heavy labor intensive process, and you gather all this data through focus group discussion or through key informants and other methods, but then you don't know what to do with it or how to analyze it, because it wasn't as targeted as possible. It wasn't speaking in the outcomes you wanted to see, or it wasn't relevant to that context. So you've done so many FGDs, and maybe the outcome you are looking for, maybe in your indicator matrix, for example, you only have 3 indicators you want to address, but you've done 10 or 20 FGTs and you have a ton of information. And then it takes time to analyze the information and also giving feedback to the community. Yeah, some of it is done, but it's not clear. So yeah, as evaluators, sometimes we overcomplicate processes and this concept of participatory M&E, and we end up messing it up, or we end up creating fatigue among the community members, so that we have been giving information with no feedback, nothing is happening. You come back again, you ask for the information, and then the next time you really need to get the information, then they are fatigued or they already know what answers to give you. Yeah, so that also has been challenging. Yeah, and yeah, so those are the ones I'll talk about. And then lastly, the aspect of buy-in, and I think it goes back to the selection of tools, so that, and methodologies. The donor wants this, but then we know this might not work. So how do you work around that to get their buy-in, so that you are used to surveys because they're easier, they're quicker, and you get information quickly. But for this community, surveys might not work. We need a gender perspective into this. So how do we engage them in a way that we will be able to get these differences and biases and diversities that exist? Yeah, so that sometimes is also a challenge, trying to get that balance. Yeah. Thank you.
Thank you, Mercy. Well, thank you so much for sharing your personal experiences and like things you've seen with your own eyes, things that work, things that don't work. It's very important to keep this in mind. And as you said, we keep learning, all of us. I get as an understanding, as a key point, I get that we should know our audience and like the culture where we are going to, with which we are going to work with, and try to be very inclusive in every stage. And yeah, of course, power relations is another important issue that, yeah, it has to be worked on all the time. My next question, it would be much related to this, to the previous question, and it's if you have suggestions for possible solutions to these challenges, apart from the ones like the very, easy to say that, yeah, we have to be more inclusive and we have to know our audience. Like in practice, do you have some specific advice to give? And for example, what kind of skills we should put in place, or, this kind of things?
Yeah, thank you so much, Faye, for that question. Yeah, as I said, it's a learning process for all of us. And from my perspective, I think what's probably mostly needed is to build a movement or advocacy around the need for participatory monitoring and evaluation. Yeah, and this is based on, just like you've said, the need to include everyone on board. They need to have beneficiary voices or people affected by the change being part of the process from the beginning. So in most cases, we end up going for the easier route, but at the same time we end up missing the critical information that we need. And then we end up spending more on an intervention that is probably not useful or culturally appropriate, or not, the community not embracing it, because I've been there before. You've done this very huge project. For example, this is an example where I used to work before. It was a rural village. We built a first-class hospital, maternity hospital, because there were so many maternal deaths, so many child deaths, children dying before age of 5, women dying during childbirth and stuff. So for us, the solution was, why don't we build this first-class facility that would have all the equipment, all the staff, very trained staff that would be able to support the communities. And it was perfect in the middle of this village. It was perfect, very nice, very modern. But then no one ended up coming, and you were like, oh, okay, so what's going on? Why aren't they coming? So then we understood that we should have involved them in the process of putting this up, and it cost a lot of money. And then quickly we realized probably we need to engage them in that process, and we can still go back to them and find out what the issues are, what are their barriers and challenges, why are they not comfortable coming, and how can we build that? How can we make sure they're able to come? What would work better for them? And it eventually worked. They came up with solutions and ideas on why they're not coming. For example, the staff were highly trained. Most of them were from other regions and the communities were like, we don't know what language we are going to speak with them when we come. Yeah, things that we could not even think about. So we don't speak their language. They speak in English. They speak in Kiswahili. We don't know any of that. So how am I going to present myself and tell them my problem? And then other issues in terms of, there were so many other issues in there that we were able to find solutions. The community themselves told us what would work better for them and how we can improve or strengthen, what areas we needed to strengthen so that they're part of the process. And
Yeah, Mercy, you've been muted.
yeah, it said I've been muted by the host. I don't know, but
okay.
it's fine. Yeah, so looking into that and coming up with having the community speak into that process is important. So being deliberate from the start, so that as we plan this, do we have community voices in this? And are we likely to succeed? And how do we get their voice into this process so that it's planned from the start? That is number one, on possible solutions to some of these challenges. And also in terms of resource allocation, when it's done from the beginning, then you're able to know what you have in terms of resources, have the conversation with the donor who is funding the process, and just choose tools and methodologies that would work for the community, work for the project, give you the information you need, but at the same time be within the budget that is available, rather than choose something that might be way beyond your ability. And then the other big one is probably the need to advocate more for participatory M&D, so that it's more included in the monitoring and evaluation processes, rather than because sometimes I feel like it's used as an afterthought, not necessarily something that we really think through from the beginning, but they need to have it as part of the process, M&D, have it embedded in the M&D processes. Yeah, deliberately, so that we allocate resources to it. We already have the buy-in from the donors, and they understand these are methodologies that we feel works better in different contexts. So planning for them in advance and just using them, not like something, hey, why can't we do this FGD? Why can't we do this? Yeah, so having it embedded as part of the process, so that we reduce some of these challenges that are coming up as a result of not making the right decisions or choosing the right tools and methodologies. Yeah, so those are some of the solutions I would give.
Thank you, Mercy. Thank you. This is valuable information. And I also see in the chat a lot of nice suggestions. Local wisdom is important, Hussein says, as they have better solutions to their problems sometimes. And as you also said, Mercy, Darius is saying a prior review of the community and smart planning will help us to prevent most of the mentioned challenges. So yeah, those are all very, very valid points. And Yeah, I mean, I learned a lot of things today. Once again, Mercy, thanks to you and our wonderful audience. I would like to move on to another question, and then depending on how much time we have left, we might move on to questions from the audience or ask a final question. So my next question to you, Mercy, is how can we best use participatory monitoring and evaluation while working with marginalized and vulnerable communities? And I think you've already touched some points in the challenges, but maybe you can give some more, any other concrete examples if you have, or some suggestions. Thank you.
Yeah, I think I'll go quickly because I see some hands already up, and I really wanted to hear feedback from the audience as well. Yeah, so some of the quick ones for me is how do we involve vulnerable and marginalized groups is yeah, the aspect of ethics, just making sure that we are doing it in a more ethical way. Like, for example, do no harm perspective, looking into that and not just looking at participatory M&E as, hey, let's go there, gather these people and have the information. It should be within the ethical standards. So planning it within the agreed ethical standards so that the bits of confidentiality is assured, respect for people's opinions and others, and also just assuring them on, for example, if you're engaging with children, for example, how do you make sure they are protected, or vulnerable groups in terms of traumatized communities, conflict, communities who have experienced conflicts, or women who have experienced abuse. How do you engage them without being so intrusive in the process, but protecting them from the experiences, and also the need to have alternative, I would say, support in terms of psychological counseling if it is needed. How do you let them get access to those services? How do you let them not give you so much information, and how do you protect them from reprisal, for example? Like some communities, it is so sensitive to discuss some of these issues, like someone who has experienced rape, and then talking to you will be seen by community as something that is not acceptable. So how do you make sure this woman is protected against reprisal and stigma? And sometimes they're shunned out, they're kicked out because they spoke, they let out community issues and sacred family issues outside the family. So being able, before you plan for this kind of engagement, how do you make sure the client or the participant is protected before even engaging with them? How are you going to protect the participant? Yeah, within the ethical standards. And also, yeah, just going in there and taking note or recognizing that there are biases that as an external evaluator that I might have that will affect the community, and also respecting that community cultural practices in the process without looking at them like this is wrong. Because I remember, especially with feminist perspectives, other communities would say, oh, this is Western, this is foreign, this is not from here. Yeah, and not pushing back and telling them, hey, you are doing it wrong, you need to do it this way, but just respecting their perspectives in the process. That's how they see it, without insisting on how you see it or the world sees it and it has to be this way. So making sure you're able to protect them from these biases and also the harm that they might experience in the process, or they have already experienced, and you don't perpetuate the harm that they have already experienced, but rather you are able to protect them from experiencing it further. Yeah, so that's some of it, but I would definitely love to hear more from the audience. So I would stop there, Faye.
Thank you, Mercy. Thank you. Yeah, these points are really important to keep into consideration. And I already see some things in the chat. So John, I'm going to pass the microphone to you, and maybe you can help us arrange the questions from the audience and the feedback for Mercy.
Thank you very much. Sorry, where's my microphone? Thank you very much. So at this juncture, we'll take questions from the audience. So if you have a question, kindly put up your hand and then we'll pick you, and then you can ask your question, and Mercy will respond to you kindly. So who has a question? Can we remove the presentation so I can see whose hand is up? Thank you. Thank you, Faye. The first question I can see Joshua Simon.
Okay. Good
Joshua,
morning.
please go next. Thank you.
Good morning.
Good morning to you. It's afternoon here. Thank you.
Okay. Good afternoon, sir.
Thank you.
Hello. Can you hear me?
Yes, I can hear you. Please continue.
Okay. Finding yourself in a hostile community. What methodology can one use, or is there an approach method that one can adapt to, like penetrate into that community to like collect your data, or like gather up your information that you want to collect? Based on the question she responded on number 3, where she said I don't know, she didn't mention the name of the community or country, but you find yourself she find herself in a community where people, maybe you are being asked to, like maybe is the methods of how they do their things. Maybe you have to sit down on the ground and, you know, things like that. So, and what I'm saying is maybe that has been the tradition of that community, and based on you are seeing that thing as a very, very hostile kind of thing. So is there a methodology that one can use for M&E to like penetrate into that? Hello?
Mercy, did you get the question?
Yes, I did. So do I take one at a time? I was hoping, it's fine.
Let's take one at a time so that it's clear and exhaustive.
Okay.
Yes.
Okay. Thank you. Yeah, thank you so much, Joshua, for that wonderful question. He mentioned about hostile community. I don't think there's a defined methodology to be used, but rather it would be important before you go in there, you do a groundwork mapping process so that you identify who are the influencers and the influential people in that community that you could perhaps use or engage at the beginning to just understand how best do I go in and get information from this group of people. For example, in my case, the influential people were the community health workers. So we realized everyone is going to them because they had built trust, they had built relationships over the years. They were flexible with them, so they trusted the community health workers. And bringing them on board really helped the project to succeed. And to date, the project is working. So we had conversations with the community health workers. How do we work together to make sure, because we are all on the same page, we have a common agenda to support the women, to support the mothers, to reduce deaths. So how do we do this together? So we were able to come up with ideas on how to work together with the community health workers or traditional birth attendants. Then they were called traditional birth attendants. And we worked together with them as the influencers, and they were able to influence the mothers, and the mothers were able to do this. And we succeeded from a monthly rates of delivery rate at the facility from 26% to 96, 97% in 1 year. So definitely for me, I think identifying the influencers or influential people and working through them to support and give recommendations and suggestions would be the best way to do this. Thank you.
Thank you very much, Mercy. Let's take another question from Joshua. Are you satisfied with the answer? All right, let's take another question from Sankwe Kambole. Sankwe is gone. Sankwe? It's disappeared. Okay, let's take from, oh, Sankwe, you're back.
He's back.
Please unmute Sankwe. Nick? Nick, please unmute Sankwe.
All right, thank you so very much, and good afternoon and good morning. All right, thank you so much. I'm Sankwe from Zambia. When I was listening to the experience of Macy, it came to me that the methodology we are talking about probably does not have a confined phase. She did mention that probably before the project even is implemented, it's important that at least you engage the communities so that at least they are on board. So if that is correct, if a situation where I think the classical example she gave about the death attendants, the classical example she gave, if in any way most of the solutions to those challenges could not be found, what would have happened to the project then? That's the first question. And linked to that, is it possible, if I could suggest that then the methodology has to be implemented or has to be used throughout the project cycle? Those are my two questions. Thank you.
Yeah, thank you so much, Sankwe from Zimbabwe, for that wonderful question. Yeah, so there were two questions about if the solutions was not found, then would it mean the project would have failed? And number two was, sorry, can you say that again? Number two, I am forgetting what you said.
What's the second question, Sankwe?
The second question was linking to the failure of the project. Can I conclude that this process can be used on all phases of the project cycle? That is from the planning vis-a-vis to the closure, so to speak, operations and as well as the closure, other than just confining to the monitoring and evaluation during operations. Thank you.
Yeah, thank you so much, Sankwe. That's clear now. Yeah, so to the first one, in most cases, we have seen projects, and I have been part of projects that didn't work or they failed, or if they worked, then there's no community ownership when the donor leaves or the project ends, and there's no sustainability in that aspect. I am sure you've experienced the same. So in most cases, if this process is not, if we don't have this as part of the process, then that's where we end up in. Yeah, and another classical example, I worked in a project where we developed, it was a eco sensitive or ecosystem or eco-friendly, yeah, we call it eco-friendly, latrine. And it was about harvesting the waste and using that waste to promote it for kitchen gardening. So harvesting it, drying it in the sun, there was the latrine was built in a way that it's able to separate the urine from the solid waste, and then because you don't want the urine, so you separate and then you harvest the solid waste, you dry it out, and then it's used as manure. We've seen those projects. And then the first time we did it, but then everyone, we were excited, oh, we have harvested, we want to demonstrate. We set up a demonstration site, and no one came. And then we reached out to the head teacher, and he was very uncomfortable about the whole thing because he was the champion. We wanted to promote this across all the local schools. So this was the pilot school. So no one came, and when we managed to get the chief, to get the people, everybody sat very, very far away. And then later on, when we asked what was the issue, then they explained it is culturally unacceptable to do that. Yeah, have people come back to the waste and it has been aired and dried, and then now we want to touch it and demonstrate. It didn't work. And it was a nicely built latrine with very nice agenda or goals. We had a very nice idea around it, so that it was not just latrine for the sake of supporting sanitation, but also adding value. It had a value addition in terms of harvesting manure to be able to develop kitchen gardens for the schools, and ultimately increasing attendance and enrollment in schools, and ultimately improving scores when kids are able to attend school, because the school is able to supply food, because they have manure to be able to grow food and harvest quickly and supply food, and kids are not going back home hungry and all that kind of thing. But it didn't work. That is where it ended, at that meeting. The first initial meeting with all the excitement, it ended there. The project never expanded. We had to communicate back to the donor all the money that was spent. That is how the project ended. It was not scientifically sound. It was not culturally appropriate. It was not relevant. They didn't want it. So it ended there, because again, it was a technology we borrowed from somewhere and we brought it to replicate it in this region. It never worked. So in most cases, that is how it will go. And to your second question, again, using that example, it is very critical to engage the community throughout the continuum process of implementation, from the planning stage to the project closeout stage, so that they are part of the process. If there are decisions that needs to be made, they are speaking into those decisions as we move along, so that ultimately they will own it. They will say, this is our project. It is speaking into our challenges. We define the solutions for it. This is how we see it happening, and this is the change we are likely to see from it. So it is definitely very important to have the participatory M&E process throughout the continuum of project implementation, rather than waiting to do it periodically when things are way too behind. Money has been spent, resources have been spent, and now we want to do this, and then it's not gonna work. Yeah, so that would be my response to your question. Thank you.
John, we cannot hear you now.
Thank you very much, Sanko, for that question, and Mercy for the response. It's very, very important that projects are community and culturally sensitive, because I had similar experience as a consultant, supporting a donor to sell such ideas, and it didn't work. I almost got beaten by that community, proposing that they can generate gas from human waste. So it's good to be sensitive. Thank you very much for that. Let's take another question from Daniel Alimo. Please unmute Daniel.
Okay. Good morning from Ghana.
Thank you. Welcome.
Yeah, mine is just a bit of a contribution to make. Is there any way, for example, let me ask this question, where M&E network all over the world will ensure that every project there should be a kind of baseline studies involving the community, what actually they need, which will be part of the project proposal before it is approved, and the process will follow to execution to the end. Because you see that sometimes NGOs, CBOs will rush and we say, well, the community need A, B, C, D, will rush and write a proposal, nice proposal, it has been approved, money has been disperse only to go to the community, and the community want to participate. So we bring them, we have this project, and they say, no, we are interested in ABCD instead of the YZ you want to give it to us. And by that time, maybe a lot of money has been spent. And you can see all over, especially Africa, a lot of waste, not waste, but costs. I don't know how I can tell you, but expensive projects are all hanging, they are not completed because nobody is, from the word go, is monitoring to ensure that there is enough funding for that project to be completed. The people they are providing that project to really is what they need as their priority. I'll give you an example to end this. In one of our communities, there's a community that they needed water badly. So an NGO, somebody we employ an NGO, they came and look at, they gave them a place to build a borehole. Nicely, they checked the water content, everything was okay, it's good for consumption. But for a long time, the people were not going to fetch water from the borehole. And then another money has been spent to conduct a study why they were not going, only to be told that where they have constructed the borehole was an old cemetery. And an old cemetery, if you are in that community, will you, no matter how sweet the water will you be comfortable drinking it? So the whole project is a waste, and nobody was, because, and that is why this webinar is so important, because if we don't involve the people inclusively, if you don't ask the people what they need and where they want their project to be sited, we might be wasting a lot of resources. And when you come to Ghana, you look at there are so many projects that are not completed for so many years. And we are crying for money. Meanwhile, resources have been pumped into those projects. What are we doing as a MAE practitioner all over to ensure that these policies are taken to government level and sub-regional level to ensure that we reduce waste and involve the people? Thank you. Over.
Thank you, Daniel. Merci.
I think that's a wonderful contribution. So yeah, he's asking about what can we do, or what are we doing to make sure we reduce some of these wastages and we really provide the community with what is needed, or we define the change in a more practical way rather than waste a lot of resources. So definitely it goes back to my comment on the need to advocate around participatory M&D, so that this is something that most people are able to pick up and define and engage with. Yeah, because I think sometimes we overlook, or we don't really necessarily plan with it in mind. Yeah, so they need to advocate amongst our different stakeholders so that it's something that will always be considered, or needs to be considered as we plan for projects. And so I think advocacy might help so that it creates more traction and more, we are able to get more people on board and to get the buy-in from particularly the donors who just want to go in there. I have the money, I just want a water project, nothing else. Even if it doesn't make sense, this is what I'm going to support. So that they see why it is important to first engage with the community, and they understand why it is critical to engage, because ultimately it will also save them on the resources that they are redirecting to the community. Yeah, so thank you so much, Daniel, for that.
Thank you very much, Daniel. Let's take another question from Mada Azrag. Mada, please go next. Mada, please go next.
Miada or Mayada Azrag. Yeah.
It's Mayada. Yes, Mayada Azrag. Mayada. Silent.
Yeah, maybe we go to someone else.
Yes, we'll come back to her or him. Shalom Mbursa. Shalom, please go next.
Okay, thank you for the opportunity. Good afternoon, good morning, depending on your time zone. I don't know if everyone can hear me.
Please continue.
Hello,
Yes, we can.
Yes,
Can
I
hear
can
you.
hear you.
I'm Shalom from Nigeria. We've had a protracted crisis and conflict here, especially in the northeastern part of Nigeria. And one of the challenges we've had, especially with participatory M&E, is that due to the protraction of the conflict, we've had donor fatigue when it comes to providing enough funding to be able to cover for both programmatic and M&E services provided in the communities. So my question is this: with the challenges facing organizations, especially CSOs, when it comes to giving some sort of designated budgetary balance to be able to aid the M&E personnel to go out and conduct the activities and ensure that they employ, especially the participatory approach. I don't know if, with your experience, you've been able to employ some sort of innovative approaches to mitigate this gap of insufficient funding. Thank you very much.
Do you get the question, Mase?
Yeah, somehow. He talked about being in a conflict or crisis environment and the challenge of resources. So if I got it right, maybe you can confirm, how can we mitigate the challenge of balance between resources and also the need for participatory M&E? Did I get that right?
Yes, exactly. Yes,
Okay. Thank you. Yeah, so yeah, thank you so much for that question. Yeah, it's a bit difficult to find the balance, but again, they're very practical tools because I know, for example, others might be resource intensive. Other methodologies might require a lot of resources and a lot of engagements because it is a process. It's not just going in and getting information and going out. So it's a process, consultative forums, organizing different stakeholders, paying for their transport, paying for their maybe venue if it's a conference kind of setup. So that might involve a lot of resources rather than just sending a link to a survey that they would respond to, which would be easier. But some of it is critical, and I think the balance is knowing what you really want to get out of this, whatever you're planning. What do I really want to get? And is it critical to have these consultative forums so that if we don't have it, then we end up with an elephant project like we've been talking about. So that is the balance that you need to do, and which being deliberate and targeted in terms of which groups of people do we need are critical. Like, for example, the example I gave, the critical group for us was not so much everyone in the community, but we knew the kind of the critical group for us was the traditional birth attendants, because they were the main barrier to all of this, and the women listened to them, the women understood them, the women trusted them. So getting them on board was a sure way of getting the women on board. So being deliberate on who you want to target based on what you're looking at, and then going straight to that group rather than an information fishing expedition where you want to engage everyone. And then you get all these views that you don't know how to package or what to do with it. So that's number one. And then number two is about, the second aspect of the how to look at this in terms of resources is the advocacy or the need to engage with the donor well in advance. If you know, we've had informal conversations in the communities about these projects. And we think this is the best way that we need to do it. So having those conversations well in advance before the proposal is complete, so that you're able, if you will need more resources allocated to M&E process, for example, because that's also the challenge. Usually when you look at the budget, the M&E has a very small budget, and the donors, some donors really push back and say, no, a lot of the money we want it on the implementation, which is great, but also having that conversation and saying, hey, if we don't do this, we don't see this project succeeding. We really think this is a critical part of the project, and we need additional resources allocated for this, so that the conversation is done well in advance, not midway. And then you realize, oh, we need to have this. This is not working. Let's convene. Let's bring everyone on board and see how to do this. And then you realize after the convening, it's taking you back to square zero, but you've already spent half of the resources or 3/4 of the resources. So figuring it out with the communities, it could be informally, and then having the conversations, or formally, if you have resources, and then presenting that to the donor and say, hey, look here, these are the meetings we had, these are the conversations we have, and based on, some of it might be based on documented evidence, some of it is just because there's different in opinions and cultures and traditions. So based on this is how we see it working, and we feel like we will need to have these initial conversations built into the M&E process, and it will need this amount of money. So if we can move things around so that, because we feel it is a critical process. So yeah, I think that would be probably another way of making sure that it's happening. Yeah, rather than just sit back and then wait to see things unfold, and then you realize, hey, this is not gonna work, and you don't know how to salvage it or make it work, because ultimately the community will hold you accountable because you're the one who brought the project. But then what value did it add to our lives? Nothing, because probably they were not part of it. So that's how I would respond to that. Yeah, it's probably not adequate, but at least that's one of the things you could do to make sure this is happening. Yeah. Thank you.
Right. Thank you, Marcin. Let's take the next question from Richard Penn, and then I'll go to Kabiro. Richard Penn, please unmute.
Okay, thank you very much for this opportunity. I want to start with a comment, and it's about when it's about considering the importance of the M&E function in the different stages of the life cycle of a project. Most often, the M&E person, the thought about an M&E person comes in when the project is already written, designed, planned, and he is recruited just to come and chain in with the implementation process. This is sometimes where the problem, the gap comes. And most of the time, the problem is also due to budgets, but I think that at the conception phase, they should integrate an expert in M&E or an M&E person at the design phase, because most of the staff are taken on board when the project is funded already, and the project and the proposal must have been written. So if this M&E function happens or is integrated, considered at the design phase, this is where they will have time to involve the communities. It will be more participatory to involve the communities in identifying the problem, justifying the problem, and designing the project. Then planning, the M&E function is supposed to be there to interact with the stakeholders, with the population, to know when to get to the field and so on, how to start familiarizing themselves with the process, so that it should not be at the end that you get to start thinking about how do I conduct, which tool should I use? It should be something that should start from the initial stage. So this is what I had to contribute concerning this whole issue of being participatory. It should come from the very beginning of identifying the project, and it has to run through the different stages of the life cycle of the project to right to evaluation. So thank you.
Thank you very much, Richard. That's a very great contribution. Let's take another. Marcel, do you need to add something towards that contribution?
No, thank you so much, Richard. That's wonderful. That's a great contribution. Thank you.
Thank you. Kabiro, go next. Kabiro Bugundu, Nigeria again.
Okay, good afternoon, everyone.
Thank you.
I'm highly interested in this session. Actually, my contribution in terms of participatory M&E activity. Actually, what I did in my workplace, M&E malaria program in my country, Nigeria. Also a state program officer on malaria elimination program in Nigeria. Actually, in my state, we look at the baseline data based on the cases indices of malaria. Then we now look at the current situation, the data we have available, looking at where are we performing well, where we need to improve. So what we did, we are looking at services rendered at facility, which are routine, while some of the cases that are coming with complication in communities. So we now use the data to look at community case management, that is ICCM, Integrated Community Case Management. Then we now look at how can we monitor and see the performance in that indicator at community level. So we leverage on CHIPS project, that is Community Health Influencers Project. That is how we come up with looking at cases of diarrhea and cholera outbreak, and also looking at among pregnant women and LLIN use. So in that aspect, the community management, we do referral of cases at community level because of accessibility, because the areas that we implement ICCM are at the hard-to-reach areas. We look at a proximity of those communities to be able to travel. So we now identified a facility to serve the referral cases being referred to the facilities, which we targeted to build the capacity of facility healthcare workers to manage those cases and to have improvement in that indicator. So that is what I normally use my data to implement, and looking at the gaps at implementation stage. That is why we targeted under 5 malaria and IPTP uptake among pregnant women. Also, we involve all the community and traditional rulers because there are a lot of sensitization happen in the mosques and churches. Also, we co-opt the youth leaders and so on. So that is what is currently working in my state. We always refer to our data to look at an indicator that needs to be improved. Then we follow it up to a word to the community and ensure we address it. And it's costless because the community influencers are living in those communities. So it doesn't take us too much stress. We always review our data on quarterly, and we have quarterly report that guided us if we are performing better in community implementation of our program. Over, thank you.
Thank you, Kabiro. Marcel?
Yeah, absolutely. Thank you, Kabiru, for adding that. Yeah, it's another way where they are resource limited situations. Then the example Kabiru gave, like using community influencers to be part of the monitoring and evaluation process, so that you don't really they are working with the community, they can get their perspectives, they can get their views, and then on a monthly basis, then you meet together to gather all this information from them. So if it is a big area, you're working in an area with 10 different districts, you can't go do focus group discussions in all these 10 districts, but you have like a standard template or a standard form that they're able to engage with the community on an ongoing basis to gather information, document it, and then on a quarterly basis, you sit together and review it together. Then, yeah, I think that's a great addition. Yeah, a great point you brought up. Yeah, especially where there's limited resources. So training, identifying people, training them and working with them. And these are community people from the same communities, sharing the same experiences with the communities, so that they're able to support that process rather than hire external M&D people who are not very knowledgeable about the traditions, the cultures, and we might end up missing a lot of that information. Yeah, thank you so much, Kabiru.
Thank you very much, Kabiru and Mase. Alhaji Jawara, please go next. Alhaji.
Yeah, good morning. I am talking from Sierra Leone. And of course, I am working in Sierra Leone. I'm working with a community-led organization. And of course, we are doing 85% of participatory M&E in our project implementation. I just have two questions. Of course, we are working on some few concepts, but one thing that is having some differences is actually, is there any differences between a community-led monitoring evaluation system and a participatory M&E systems? Because these are two terms. I know they are similar, they are the same, but it has been difficult to actually identify what are the differences between these two M&E systems. And the second question here is how to integrate a scientific method into a participatory M&E system. I have been having this challenge in most of our projects. As I like to say, I am the head of the M&E unit for our organization. So what we do in our organization, we allow community to identify their projects, their constraints and their challenges, and we support them to implement their project. So what we have realized here is, of course, we want to see how we can support community with a scientific method base in identifying some of this problem. Because, okay, let's say, for example, most times we go into community, we can understand, for example, if a specific somebody may have a cancer, and this cancer is very dangerous, but he also needs a shelter to live under. If he asks that somebody to prioritize between the cancer and, of course, the shelter, he or she will automatically choose the shelter. But as a development practitioner, we understand that cancer is very important to actually look into as your first priority. So we have been trying to bring this scientific method to actually convince or actually support these community people to look at the scientific method so it can help them to choose their priority. And it has been a bit difficult. So is there any reliable or any way we can increase in terms of letting the community know that it's good, of course, to choose the priority. We want them to be free to choose a priority, but how they can use the support scientific data we provide to them in making decisions based on their priorities. So thank you. These are my questions.
Thank you. Thank you. Mercy would like to add something to his contribution.
Yeah, thank you so much. I just have a question. Your second question, you said how to integrate this system into the participatory system. I didn't understand the first system.
Yes, how to integrate a scientific M&E method.
Scientific. Okay.
Yeah, like we are doing the multi-dimensional poverty assessment index. These are scientific methods that helps us to track the poverty level of our beneficiaries. So we collect the data, and this data is presented to the stakeholders that can guide them to choose their priority. But it's been difficult for them to accept, one, because it is scientific, they do not understand the methods. That is one. How best can we make sure this is integrated into the participatory M&E systems?
Okay, thank you so much. So those were two questions. One is community-led monitoring and evaluation system versus the participatory M&E system. For me, I think those two are the same. They mean the same thing. And yeah, so for me, those two, I feel like it's community-led, because the idea of participatory methodology is to have the community leading the process of planning, implementation, and evaluation. So it's community-led. Community voice is represented in all the decisions and in all the processes, the project monitoring and implementation cycle. Yeah, community voice is represented in that. So I think, to me, those two mean the same thing. And then to your second question, so is how to integrate the M&D, so integrate the scientific M&D methodologies into the participatory methodologies or system. Yeah, so just to put this out there, it doesn't mean we don't, by participatory M&D, we don't mean we need to replace the other methods, the scientific methods of M&D. Definitely, that's not the idea. The idea is we need to include the communities more in the process, because sometimes the scientific methods exclude, because we already have defined tools, defined indicators that we are looking at, and we want to score or prioritize. And maybe out of all those priorities listed, none of them speaks into the community needs. So then how do we make sure community needs are represented in that scale we are using? It could be a rating scale or something that was already defined or developed by someone. So how do we make sure we integrate this, or we ensure their voices are represented? And in most cases, it's about contextualizing the tool, taking the tool and you contextualize based on the context you're working in. If the tool was developed in a non-conflict area and you feel it might be relevant in a conflict zone or conflict area, then how do you contextualize that? Or it was developed in another community, but it might be relevant in a pastoralist community, then how do we contextualize the tool? So looking through those indicators, having meetings with the community members to make sure the tool speaks, and if it doesn't speak, how do we replace, or what is the equivalent of what was put under this category? How does it apply in your context? And then you make sure you contextualize. That way you get the community participatory is already part of the scientific process that will come out, the results of that scientific process. And then number two, the other way you can integrate that is sometimes we do survey to give us a quick snapshot of the situation, or a quick overview of the current situation or what's happening, because they're quicker way of giving us a snapshot. And then based on that snapshot, then this is what we've come up with. So then that is what you go back with the community, and you can either use scoring or ranking to be able now to identify and prioritize the issues. And if it is like, for example, why it is important to have a cancer clinic vis-a-vis livelihood project. I know we've been there so many times. People say, no, for us, we need livelihood project. We don't need that clinic. But ultimately, in the long term, once you have those conversations, then the community will understand why it is important. Because some of them might look foreign to them at this point. But once you sit down with them, engage with them, try to explain why ultimately you will need the clinic at some point, and why it might save so many lives, yes, livelihoods is important at this point, but ultimately this will also be important because of ABCD. So you are taking the tool or the indicators within that tool and breaking it down in a more palatable way or a more simpler way for them to understand. So that way, then when you are using that tool, then they understand if they're scoring, if we need to score a cancer clinic versus a livelihood project, they have a clear background on what they need to score, rather than just a list of indicators that they need to choose from. So that way you're integrating both systems, but with an informed, the community has an informed perspective, or they're standing from an informed point of view, rather than just, hey, this is the tool, these are the indicators, we want you to choose one. And then they don't understand any of those indicators you provided. But if you engage them through those conversations and then let them now score based on that tool, then they understand what they're scoring. So I think for me, those are the two that I think would be important. You can do it before the tool by explaining the tool, or after the scoring has happened, you go back to them, tell them, we did this survey, this is what came out of it, what do you think? And then let's have a conversation around these key priority areas that came through that snapshot process of the survey. So these were the issues that people scored. So can we discuss some of these issues? And then you discuss it through a consultative forum or a focus group discussion or a key informant interview, whichever forum you want to use, or a reflection meeting. Yeah, these were the results of the study. So, or the intervention. What do you think about this? And then they will tell you what is the most significant change out of all these 3 changes that have been identified by the evaluation. What is the most significant change for you and why? And then they will explain it. And then, yeah, so that's how I would respond to that. Thank you.
Thank you very much, Marcel. That's well expounded. I think we don't have another question. There's a guy whose hand was up, but I think he's probably changed his mind. So I think at this stage, let me invite Faye to give closing remarks. I don't know if would you like to say something, and then Marcel, then we can close. Oh, David. David is back. Sorry, Faye.
Yeah,
David is back. He disappeared. David Bizimana. Let's take one last one. David. Nikron, please unmute David.
Okay. Good afternoon.
Good afternoon to you, David.
Yeah, this is David Bizimana. I'm talking from Uganda. So thank you for this big topic on M&E involving community programming. First of all, it's an interesting topic, and I don't think we shall have enough time really to exhaust all the inputs from the participants. And I would like just to contribute quickly due to time, especially on some presentations when people talked about project failures and successful ones. The good examples we had from Ghana and Nigeria, and I have more than 30 years experience in project implementation. I've implemented World Bank funded programs and donor funded programs that they are called CBOs and NGOs as implementing partners. I think beyond M&E participatory activities, you also should include during implementation, because M&E is part of implementation. So you just say implementation, monitoring and evaluation, and involve participatory. Now, the success and failure of the project, someone mentioned it, it starts from at the inception and design phase. If the design is bad, then the project will fail completely, even if you put in all the necessary inputs. I have 2 examples. I need to be quick also. World Bank funded project where communities were supposed to contribute bricks for construction of a school, and they thought the bricks could be used. Unfortunately, the soil was poor, and yet there was sand around the lake shores. And if they had thought of using cement and the sand, the project would have been successful. But because they insisted of using of soil bricks, the project failed. Now, that's one way of art identification and design. The success one is where we say participatory involvement in implementation and also identification. In a gravity water scheme which I was involved in, during that gravity design, I asked the communities where we should put the taps, the standby taps where communities would get the water. Other than myself saying, locate this tap here, locate that tap there. It brought in ownership, and the communities cited where they wanted these taps to be. So it's successful because the communities participated in identifying where the tap water sources would be. And we elected the community leaders, and the participants elected the leaders to take care of the water source. So they took over the project and were successful. Those are two cases I could cite about success and failures, and what level do projects succeed, and the important role of community participation in project implementation, monitoring, and evaluation. As I said, it's time constraint now to talk over and over again about these examples, but thank you for this big important topic. I came in late, I may have missed a lot, but I request that they share the recording and request that another day be scheduled for a similar topic for others to participate, for others who have not participated. Thank you.
Thank you very much, David. Mercy, would you like to add something to that contribution?
Yeah, thank you so much, David, for your contributions and for adding into what we have been speaking about. Yeah, and definitely very critical in terms of, oops, can you hear me? My network is?
Yes, we can hear you.
Yeah, so thank you so much, David. I feel it's very critical to have the community engaged in the process so that we reduce some of these challenges or experiences of the project failing. Yeah, so we have talked about that, and sorry you came in late. Yeah, but definitely I hope Faye and John, you can also share the recording and the notes from the meeting with the rest of the people. Yeah, thank you so much, David, for your contribution.
All right, thank you very much for all those vast questions, and Mercy. Let's invite Faye to give closing remarks, and I'll come back to you, Mercy. Faye, please go next. Thank you.
Well, yeah, thank you so much. I would like to thank every one of you personally. Well, Mercy, thank you so much for all these incredible insights you shared today, and for staying for a whole 1 hour and a half with us, talking about all the things you know. This is greatly appreciated by the community and ourselves. John, thank you so much for hosting us, for hosting Activity Info once again, and a very interesting topic. Uruz, also thank you very much for supporting here in the chat, and of course a big thank you to the audience. More than 140 people are still here listening in, and it's amazing to see such active participation. I wanted to let you know that tomorrow we also have a session on participatory M&E. It's an open discussion. Uruz has shared the link if you want to register, and we can continue some of the conversation there too. That's it. Thank you so much. And yes, see you soon.
Thank you. Thank you very much, Faye. Always a great pleasure to partner with you and Activity Info. Mercy, closing remarks, please.
Thank you. Yeah, mine is also just to thank everyone for joining this conversation with us, and also thank you, Faye, Uruj, and John, for inviting me to be part of the webinar. I really appreciate. I've also learned a lot from the audience, and hopefully we can continue this tomorrow and in future conversations. So thank you so much. I am humbled. Thank you.
Thank you very much, Mercy. That was a very great discussion, very great learning session for all of us. And most importantly, the importance of involving the community and the importance of integrating M&E in project, or the whole project process, including project design. From me is to thank you very much, and thank you our global community involved in monitoring and evaluation. This is our last webinar for the year, so we wish you great holidays. I know people have not taken their breaks, but we wish you great holidays and the new year. And I would like to add that there are lots of questions about sharing the recording. What we do is tomorrow we'll upload this recording on our YouTube channel. So check out Strategia Netherlands on YouTube, and you'll have the recording there. There are about 51 other videos there for different programs, including project management, fundraising, water and sanitation. So visit our channel, and you can click and view the program from tomorrow and the others. And just to thank you for your support throughout that year, we will give a free diploma course to one of you participants. So what you need to do is send a summary of what you've learned in not more than 1 page. People don't like to read so much these days. Send a summary of what you've learned to info@strategianetherlands.nl. The first one that comes in the next 1 hour will give you a free 6 months monitoring and evaluation course. Thank you very much for your support. And I think we end there. So have a great afternoon, have a great evening, and let's keep talking about monitoring and evaluation and doing our best we can to make change to our communities. Thank you very much, everyone.
Thank you. Thank you so much, everyone.
Bye-bye.
Bye.
Bye.
Did you know that 67% of Africans don't have access to proper housing, 56% have no access to water, and 79% have no access to food? These are the grim statistics of challenges facing Africa today, even as the continent works to develop. This development demands for well-trained personnel. At Capacity Africa Training Institute, we have been leading the charge in changing Africa's form. We are the leading development training company in Africa, offering institutional training solutions and online and distance learning in business, development, and humanitarian courses. Over the last 10 years, we have trained over 10,000 staff from NGOs, governments, and the United Nations in Africa. Our catalog consists of over 200 career-focused online courses to choose from, and registration for diploma and postgraduate courses is now open for the following courses: Postgraduate Diploma in Monitoring and Evaluation, Postgraduate Diploma in Water, Sanitation and Hygiene, Diploma in Community Development, Postgraduate Diploma in Strategic Planning and Management, Postgraduate Diploma in Grants Management, Diploma in Project Management, Diploma in Nutrition and Dietetics, Diploma in Gender and Development, Diploma in Leadership and Management, Diploma in Finance Management for NGOs, and many more. We have also partnered with the European International University to offer an executive MBA. Once you register, you will have access to our team of experienced trainers and specialist consultants who will guide you on your course whenever you need them. The cost for diploma courses is $800, while postgraduate courses cost $1,200. The cost of a 1-year MBA course is €1,500. Visit www.capacityafrica.com for more information. Are you interested in building a career in the development and humanitarian sector? Then, Strategia Netherlands is the best option for you. We offer training solutions to the United Nations, governments, NGOs, and other development organizations worldwide. Make your online application now for Diploma in Monitoring and Evaluation, Diploma in Grants Management, Diploma in Conflict Management, Diploma in Disaster Management, Diploma in Water, Sanitation and Hygiene, and many more. The cost for diploma courses is 800 euros, while postgraduate courses cost 1,200 euros. Visit www.strategianetherlands.nl for more information.